A virologist explains about LamdaVariants Covid-19. According to the World Health Organization, the Lambda coronavirus strain was first detected in Peru in December 2020. WHO. It then spread to several South American countries, where it now accounts for over 20% of all detected varieties. In April, one case of Lambda was discovered in a hotel quarantine in New South Wales. Lambda has now been discovered in over 20 nations worldwide. Lambda is a variant under monitoring according to the European Centre for Disease Prevention and Control, and a variant under inquiry according to Public Health England. The WHO classified it as a variant of interest in June of this year. This is assumed to be owing to changes that affect the virus's properties, such as how easy it spreads. Though it isn't yet serious enough for the WHO to classify it as a variant of concern like Alpha or Delta. The exact threat Lambda poses is yet unknown based on epidemiological information. As a result, further research is needed at this time to determine how its mutations affect transmission, its ability to elude vaccine protection, and the severity of sickness. According to preliminary findings, Lambda has an easier time infecting our cells and can outsmart our immune systems. Vaccines, on the other hand, should be effective against it. Infectivity, or the virus's ability to infect cells, can be increased by mutations altering the spike protein of the SARS-CoV-2 virus. Furthermore, because many coronavirus vaccines are based on the spike protein, alterations to the spike protein in novel variations can have an impact on vaccine effectiveness. The spike protein in Lambda has numerous mutations. One mutation, F490S, has already been linked to decreased susceptibility to COVID-related antibodies in patients who have recovered. As a result, antibodies produced by infection with the original Wuhan strain of COVID aren't as effective at neutralizing Lambda. According to a risk assessment prepared in July by Public Health England, there isn't enough information on Lambda to determine whether infection increases the likelihood of serious disease. Continuous surveillance should be adopted as a priority in countries where both Lambda and Delta are prevalent, according to the risk assessment. The goal would be to see if Lambda is capable of competing with Delta. With the coronavirus's high levels of transmission continuing, there's a chance that new varieties will emerge. The Lambda mutation emphasizes the danger of these mutations enhancing SARS-CoV-2s to infect cells or disrupting existing vaccinations and antibody medicines. Lambda will be studied further by the WHO to see if it has the potential to become an emergent risk to global public health and a source of worry. Another Lambda mutation, L452Q, is detected in the same spot in the spike protein as a previously studied Delta mutation, L452R. This Delta mutation not only improves the virus's capacity to infect cells, but it also facilitates immunological escape, making vaccination antibodies less likely to recognize it. F490S and L452Q are both mutations in the receptor binding domain, which is the component of the spike protein that binds to our cells.